Hello everyone. So today's topic is white matter of cerebrum. At the end of the session you should be able to describe the white matter of cerebrum and related applied anatomy. These are the content of the today's session: introduction, classification, the different type of white matter, that is association fiber, commissural fiber, projection fiber, and summary. So as you know, the white matter are bundle of axon. They are myelinated and they are supported by the neuroglial cells. Now classification. So based on the function and arrangement, they are, here you can see association fiber, commissural fiber and projection fiber. Association fibers are present within the same cerebral hemisphere. Commissural fiber connect to cerebral hemisphere and projection fiber connect the cerebral hemisphere with other part of the brain. Okay, example is internal capsule. Okay, so first association fiber. Association fiber connect different parts of cerebral cortex of same hemisphere. So these are intrahemispheric fiber. They are classified into short fibers and long fiber. You can see here the short fiber, they interconnect the adjacent gyri by hooking around the sulcus. They can be intracortical or subcortical. They are also known as arcuate fiber. Long fibers, they travel for long distance and interconnect the widely separated gyri, that is gyri of different lobes. So you can see here the association fiber connecting here frontal lobe to the parietal, and here the occipital, and here the temporal lobe. Now what are the different example of long association fiber? So there is something known as superior longitudinal fasciculus, inferior longitudinal fasciculus, uncinate fasciculus, cingulum and fronto-occipital fasciculus. So superior longitudinal fasciculus, you can see here they are extending antero-posteriorly and they are situated above the here insular area, and also they are outside the fibers of corona radiata. As you remember, fibers of corona radiata are the centripetal fibers which are converging and going out of the cerebral hemisphere. They begin fanwise from the frontal region. So they all are beginning here, they are converging here, and they are terminating again fanwise. Again they are spreading here to connect with the areas 18-19 of occipital cortex and also temporal cortex. So they are connecting link between frontal and occipital eye field. Then inferior longitudinal fasciculus. They extend again longitudinally. Here you can see inferior longitudinal fasciculus longitudinally along lateral wall of posterior horn of the lateral ventricle, outside fibers of optic radiation and fibers of tapetum of corpus callosum. So they are connecting area 18 and 19 of occipital cortex here, and also most area of the temporal lobe. Then uncinate fasciculus. These are the uncinate fasciculus white fibers. So they are hooking around the floor of the stem of lateral sulcus. They are connecting the Broca's area 44 and 45. You see here, remember, they are present in the frontal lobe with the orbital surface of the frontal lobe also. Okay, orbital surface of the frontal lobe along with the temporal pole here and the area 22 of superior temporal gyrus here. Okay, so that is, these are the fibers of uncinate fasciculus. They lies inferolateral to the insula. They convey visual and auditory images of words to Broca's area of dominant cerebral hemisphere for expression of spoken speech. Okay, so these are fibers of uncinate fasciculus. Then there is cingulum. So cingulum, these are the arched association fiber of limbic lobe. They are lying within the cingulate gyrus. So here is the cingulate gyrus within which the white fibers known as cingulum are present. They are extending from the area below the rostrum of the corpus callosum. So here is the rostrum of the corpus callosum. They are arching beneath gyrus cinguli or cingulate gyrus and finally spreading into parahippocampal gyrus. So parahippocampal gyrus is present here. They forms the Papez circuit for emotional integration. Now fronto-occipital fasciculus. So fronto-occipital fasciculus are present here, they form the fronto-occipital fasciculus are present here, this green color, they form the subcallosal bundle that is present beneath the corpus callosum. They occupy the interval between the corpus callosum and lateral border of the caudate nucleus. They convey projection fibers from cerebral cortex to the caudate nucleus. So here is the summary of the different association fibers: superior longitudinal fasciculus, inferior longitudinal fasciculus, uncinate fasciculus, cingulum and fronto-occipital fasciculus, and what they are connecting, what different functional area they are connecting. Okay, so here you can see the superior longitudinal fasciculus, you can see the uncinate fasciculus. Okay, now commissural fiber. So commissural fiber, you can see the inferior view, you can see coronal view. Okay, so here they are crossing the midline, they connecting corresponding parts of two hemisphere, okay, two cerebral hemisphere. So example of commissural fiber are corpus callosum, anterior commissure, posterior commissure, habenular commissure, commissure of the fornix or hippocampal commissure. So you can see here the corpus callosum, you can see here corpus callosum in the coronal section, which is forming the roof of the lateral ventricle. Okay, this is the midline sagittal view, and here you can see the transverse section where you can see the hippocampal commissure connecting the two column of the fornix. Now first is corpus callosum. So corpus callosum is the longest or largest commissure. It is 10 centimeter long and it has 300 million fibers. It forms a massive arched interhemispheric bridge in floor of the medial longitudinal cerebral fissure connecting the medial surface of two cerebral hemispheres. Here, if you see in the sagittal section, it is the corpus callosum is seen as C-shaped mass of white fiber on the medial surface of the cerebral hemisphere, and it also forms the roof of the lateral ventricle. Its inferior aspect, inferior aspect of corpus callosum is connected here with the superior aspect of the fornix by this septum pellucidum. Okay, corpus callosum connect all parts of the cerebral cortex of two sides except lower anterior part of temporal lobe here. Okay, so the parts of corpus callosum are rostrum, genu, trunk and splenium. So you can see here, this is rostrum, this is genu, this is body or trunk, and this is splenium. So you can see again here, this is rostrum, this is genu, this is body and this is splenium. Now parts of the corpus callosum, first is genu. So genu is situated here. It consists of thick curved anterior extremity of corpus callosum, which is lying 4 centimeter behind the frontal pole. So here is the frontal pole. So it is lying 4 centimeter behind that. Okay, so fibers of genu are curving forward on either side into anterior part of frontal lobe. So you see here how they are going into the frontal lobe, and they are forming one fork-like structure that is known as forceps minor. Then there is rostrum. So rostrum is here extending downwards and backward as a thin prolongation to join the lamina terminalis, forming the rostrum of the corpus callosum. So here is lamina terminalis. So from genu to lamina terminalis, the part of corpus callosum is known as rostrum. Now the trunk. So here is the trunk, the main middle part of the corpus callosum, which is having thick anterior genu and posterior splenium. Okay, we can see here, this is the body or trunk, here is genu and here is splenium. Okay, splenium, it is massive posterior extremity of the corpus callosum, and here it is lying 6 centimeter from the occipital pole. The fiber are connecting the parietal, temporal and occipital lobes of two cerebral hemisphere. Okay, posterior part of here the parietal lobe, then also the temporal lobe and also the occipital lobe. Fiber connecting the occipital lobe, you can see here, just like the frontal lobe, here the fibers of the occipital lobe are connecting by here fork-like structure that is known as forceps major. You can see here the relation corpus callosum, you can see above there is inducium, glycium, there is the anterior cerebral artery, here is the septum pellucidum, and on either side of septum pellucidum there is lateral ventricle. Okay, so what are the fibers in the corpus callosum? Rostrum, so rostrum is present here, it connects the orbital surface of the frontal lobe. Then there is forceps minor, it connects the two frontal lobes. Then forceps major, it connects the two occipital lobe, and tapetum, these are the fibers present here, these fibers of the corpus callosum which are not intersecting the corona radiata. What you are seeing here, this is the corona radiata where the centripetal fiber from the cerebral cortex are converging and they are going into the internal capsule. Okay, now when you see the horizontal section, tapetum is here. Okay, these are the fibers of tapetum which are not passing through the corona radiata. Okay, and they are forming here the roof and lateral wall of the posterior horn, and also, which is not seen in this diagram, they are also forming the lateral wall of inferior horn of the lateral ventricle. Then there is bulb of the posterior horn. So here these fibers are forming a swelling in upper part of medial wall of posterior horn of lateral ventricle. Okay, so the tapetum is related to the posterior horn of the lateral ventricle in two ways. Some fiber are forming roof and lateral wall, and other fibers are forming the bulb of the posterior horn. What are the functions of corpus callosum? So it is responsible for interhemispheric transfer of information, which is essential for bilateral response and learning response. It helps to coordinate activities of both hemispheres. What is the applied anatomy? So the transection of the corpus callosum causes split brain syndrome. Patient will be unable to match an object held in one hand with that in the other hand. He will be not able to name object held in the left hand. That condition is known as anomia. Okay. Then another example of commissural fiber is anterior commissure. Here the small round bundle of white fibers, they are present, they cross midline in upper part of lamina terminalis. Remember, here is the lamina terminalis. Lamina terminalis is the here which is present next to the rostrum of the corpus callosum, and it forms the anterior boundary of the interventricular foramen of Monro. So the anterior commissure consists of two fibers, the large posterior forming the neocortical component which connects the lower and anterior part of temporal lobe, and a smaller anterior paleocortical component which connects the olfactory region of two cerebral hemisphere. Okay, so these two component are present in the anterior commissure. Then there is posterior commissure. So you can see here the posterior commissure is slender bundle of white fiber which crosses midline through inferior lamina of stalk of pineal gland. So you can see here, this is the pineal gland and this is the stalk of the pineal gland, and this is the inferior lamina. So within inferior lamina, the fibers of posterior commissure will be passing through. Then there is habenal commissure. So here you can see again, this is pineal gland, this is stalk of pineal gland, and this is superior lamina. So a slender white bundle of fibers, okay, which crosses the midline through the superior lamina of the stalk of pineal gland. Okay, then there is hippocampal commissure. Okay, hippocampal commissure is commissure of fornix. So you can see here the fornix, and these are two crura of the fornix, and they are joined together by the commissure of the fornix. So the hippocampal commissure connects the two crura of the fornix of two sides, and they forms the hippocampal formation. Now projection fiber. So projection fiber connect the cerebral cortex with other part of the CNS, that is brain stem and spinal cord. These fiber can be corticofugal, that means they are going away from the cortex, they are descending fibers. That can be corticopontine, corticobulbar or corticospinal, and then there are corticopetal, that is ascending or they are going towards the cortex. and example is thalamocortical. Okay, so these two are the fibers which are present in the projection fiber. Example of projection fiber: corona radiata, internal capsule, and fornix. So these are three example of projection fiber. And what projection fiber will be present within that? Either the descending fibers or ascending fiber. You can see the red color and the green color. So here some are descending, some are ascending. So among them, the first example of the projection fiber is corona radiata. So from entire neocortex, the projection fiber are converging here to periphery of the corpus striatum. Okay, and there is fan shape arrangement, mostly are intersected by the commissural fiber of the corpus callosum and anterior commissure, but the tapetum are not intersecting the corona radiata. They are continuous below with the fiber of internal capsule, which divide the corpus striatum into caudate nucleus on medial side and lentiform nucleus on the lateral side. Okay, so corona radiata is example of projection fiber. Okay, you can see here how they are converging. Some are descending, some are ascending. Okay, so you can see here. So if you are seeing here the corona radiata, so there is medial to the corona radiata, there is fronto-occipital fasciculus. Remember, we have seen the fronto-occipital fasciculus in the association fiber, and laterally there are superior longitudinal fasciculus, which are, so here these are the superior longitudinal fasciculus, these are the fibers of the fronto-occipital fasciculus, these are the fiber belonging to the association fiber, and in between them is the corona radiata, which is example of projection fiber. So now you see here, either the fibers are coming here like this and they will be passing here. That is the location of internal capsule. Internal capsule is, again, as I have told, it is dividing the corpus striatum or basal nuclei or the basal ganglia into medially there is caudate nucleus and laterally there is lentiform nucleus. This lentiform nucleus consists of globus pallidus and putamen. We will see in next slide. Okay, so you can see here again these fibers. Okay, so now you can see the association fiber, they are present within the same cerebral hemisphere. Projection fiber, they are going from the cerebral cortex to the other part of the brain, that is brain stem or spinal cord. And here is the image of the fornix. Okay, now fornix. So fornix are large bundle of projection fiber. Okay, so on medial surface of the cerebral hemisphere seen as arched prominent bundle of white fibers below the corpus callosum along lateral border or lower border of septum pellucidum. I have told you already, between the corpus callosum and the fornix there is septum pellucidum. You can see here septum pellucidum. So what you are seeing, these arched fiber, these are the projection fibers. So what they are doing, they are connecting the hippocampus with the mammillary body. Okay, so you can see here the mammillary body and here is the hippocampus. So they constitute sole efferent system in the hippocampus. There is one fornix in each cerebral hemisphere, but two are so closely related and fused beneath the middle of the body of the corpus callosum that they are usually described as single structure. Actually, they are present in both the cerebral hemisphere, but they are described as single structure. So this is fornix. What is the origin, course and distribution of the fibers? So the fibers of fornix arise from the pyramidal cells of the hippocampus and form a thin layer of white fiber on its ventricular surface. So that is known as alveus. So alveus is present here. That is the beginning of the fibers of the fornix. Okay, and they are coming from where? Pyramidal cells of the hippocampus, and they are forming a thin layer of white fiber on ventricular surface. Okay, what ventricle will be present here? There will be inferior horn of the lateral ventricle. Now, the alveus will collect on the medial margin of hippocampus to form a narrow strip of white matter. So now this will continue as fimbria, okay, which is lying flat over the dentate gyrus. Remember, when we have seen the cerebral hemisphere, on the inferior surface there was dentate gyrus. Okay, now this fimbria. Okay, so we have started with alveus, then there was fimbria. Now this fimbria is continuing here as a round bundled band that is known as crus of the fornix. So this is the crus of the fornix, and it is arching upward medially and forward underneath the splenium of the corpus callosum. Can you see here the corpus callosum? So this is the rostrum, genu, body, and this is the splenium of the corpus callosum. Okay, so we have started with alveus, then there was fimbria, now there is crus. Okay, so here was the alveus, here was the fimbria. Now here are two crus of the fornix. Okay, and then they will fuse here by the commissure of the fornix, and they continue here as the body of the fornix. Okay, so that is body of the fornix, and in the anteriorly the body of fornix again is divided into two columns, that is known as column of the fornix. So you started with alveus, that is the beginning from the pyramidal cells. Okay, then here there is fimbria, then there is crus of the fornix, okay, which are joined together by commissure of the fornix, then there is body of the fornix, and there is column of the fornix. Okay, so each column of the fornix arching downward and towards the anterior commissure. Remember, we have seen anterior commissure was here and form the anterior boundary of interventricular foramen. So that is anterior boundary of interventricular foramen. Okay, then what happens? So here they are curving posteriorly through the hypothalamus to end in the mammillary body. Okay, so they are ending here in the mammillary body. So if you see this image, the fibers are actually starting from the amygdaloid body, because they will have connection with the amygdaloid body. From here there was alveus, fimbria, there was crus, there was column of the fornix, and there is mammillary body. Okay, so these fibers which are located posterior to the anterior commissure are known as post commissural fornix. Okay, there is something known as post commissural and pre-commissural fornix. Okay, because that is division by the anterior commissure. Remember, anterior commissure was example of commissural fiber, and we are talking here about the, what is that, projection fiber. Then you can see pre-commissural fornix. I have shown you. So this is pre-commissural fornix, this is post-commissural fornix. Okay, so if you want to summarize the fornix, so main part of the fornix are fimbria, crura, that is two crura are there, or one crus. We can say singular is crus and plural is crura. Then there is body, there is column. Okay, so fornix is actually only tract of cerebrum which contains all the three type of fibers. It contains projection fiber. Why projection fiber? Because it is connecting the temporal lobe here with the frontal lobe structure. Then it has commissural fiber. You remember the commissural fornix is example of commissural fiber, and the association fiber, again the whole of this tract of the fornix. So all the three example of the white matter of cerebrum are present here in the fornix. Okay, another example of projection fiber is internal capsule, which is very important topic. Okay, so it is compact bundle of projection fiber which is present here. You can see here medially there is thalamus and there is caudate nucleus, and laterally there is a lentiform nucleus. So lentiform nucleus consists of outer aspect putamen and inner aspect globus pallidus. So this V-shaped structure what you are seeing, this is internal capsule. So I already told you the caudate nucleus and combinedly putamen and globus pallidus, they are known as lentiform nucleus. So lentiform nucleus and caudate nucleus forms the basal nuclei or basal ganglia, or also known as corpus striatum, and this is thalamus which is belonging to diencephalon. Okay, so location of the internal capsule is medially caudate nucleus and thalamus, and laterally lentiform nucleus which consists of globus pallidus and putamen. So they consist of ascending and descending nerve fiber which connect the cerebral cortex with the brain stem and spinal cord. So you can see here the coronal section. Okay, and here you can see these fibers are coming here. Sorry, this is not coronal section, this is transverse section. Okay, so in transverse section you can see here the insula, you can see here these fibers are converging here. Okay, so this V-shaped structure is the internal capsule. So internal capsule, as I have already mentioned, consists of, this is the coronal section, you can see here this is thalamus, and here caudate nucleus is not visible because it is present anteriorly, and here is the lentiform nucleus. So these are ascending and descending fibers, and the ascending fibers, as we know, because for them gateway is through the thalamus, so they are passing through the thalamus. Okay, the descending fibers here, they all will converge here. First they will pass through the corona radiata, then they will pass through the internal capsule, and from here they will pass through the cerebral peduncle, then they will pass through the crus cerebri of midbrain, they will pass through the basilar part of the pons, and then they will pass through the medulla, and ultimately they will go to the spinal cord. Okay, so these are the example of descending fibers, and here are the example of, these are the example of descending fibers, and here we have seen the ascending fibers starting from spinal cord, and then medulla and pons, and then midbrain. Okay, then they will be passing through here thalamus, and then they will be going to the cerebral cortex. Okay, now shape and parts. So if you see in the horizontal section, this is the shape of the internal capsule, which is V-shaped, and what are the parts? There is anterior limb, there is genu, there is posterior limb. Okay, these three structure we are seeing, and then there is behind the, here behind there is some part, so that is actually in behind to the lentiform nucleus, that is known as retrolentiform part of the internal capsule, and then there is sublentiform part of the internal capsule. Okay, now what, so you here you see here there is anterior limb which is present between the head of the caudate nucleus and the anterior part of the lentiform nucleus. Then there is posterior limb which is present between the thalamus again and the posterior part of the lentiform nucleus. Genu is present here between the anterior and the posterior limb. Okay, then retrolentiform part is present here behind the lentiform nucleus, and sublentiform part is present beneath the lentiform nucleus. What are the relation? So if we see here, this is the internal capsule. So medially there is caudate nucleus and there is thalamus. Laterally there is lentiform nucleus consisting of globus pallidus and putamen, and superiorly, as we know, superiorly there is corona radiata, and inferiorly there is crus cerebri of the midbrain. Okay, so what are the fibers which are present in the internal capsule? So first we will see the here anterior limb. So anterior limb, there are frontopontine fiber, as you know, from frontal lobe to the pontine nuclei and then to the neocerebellum. So that they are forming the frontoponto neocerebellar fibers. Then there are anterior thalamic radiation. They are coming from anterior and dorsomedial nuclei of thalamus to the frontal lobe, including the frontal cortex. So these are descending, these are ascending fibers. And so then there are afferent and efferent fibers. They connect the anterior nuclei of thalamus with the cingulate gyrus, and they form the pathway for Pepe circuit for emotional integration and recent memory trace. Then there are fiber of medial forebrain bundle. So they connect the orbital surface of frontal lobe with the hypothalamic nuclei, and there are some of the corticostriate fiber are there, that means from the cerebral cortex and reaching to the caudate nucleus through the subcallosal bundle and anterior limb. Then what are the fiber in the genu? So they are corticonuclear fiber from the area 4, 6 and 8. They are connecting to the motor nuclei of cranial nerves in the brain stem of the opposite side. They regulate the contralateral movement of head, that is of eyeball, face, lip, palate, pharynx, larynx, tongue. Okay, so these are corticonuclear fiber which are present here in the genu. Here you have seen corticopontine fiber, descending fiber, and you have seen The here you have seen the anterior thalamic radiation, you have seen afferent and efferent fibers, and also some fiber of the corticostriate pathway. Okay, then there are in the genu there are corticoreticular and some fiber of superior thalamic radiation. So they are connecting thalamus with the cerebral cortex. So these are present in the genu. Then there are posterior limb. So in the posterior limb, as we know, posterior limb is longer than the anterior limb. So here are the fiber of corticospinal tract. From the area 4 and 6, they regulate movement of the contralateral side of the body. So why you should know about the internal capsule? So this internal capsule is supplied by different branches from the circle of Willis or the vertebral and the carotid system. So a small compromise of the blood supply, suppose, which is supplying the genu. So whatever fibers are present there, that will be affected. In the same way, if blood supply of anterior limb is compromised, so whatever fiber are there, that function will be affected. So here you see in the posterior limb there is corticospinal tract, which are coming from area 4 and 6, which are regulating movement of contralateral side of body. So in rostral part of the posterior limb, here in the posterior part of the posterior limb, upper limb is in front, trunk is in the middle, and the lower limb is behind. So you can see here there is the lower limb, trunk, and the fiber of the upper limb which are passing through the posterior limb. Okay, then the corticorubral tract, the fiber from area 4 and 6 to the red nucleus of midbrain. Okay, also through the posterior limb, the fiber of superior thalamic radiation, that is anterior ventral and intermediate ventral nuclei of thalamus, which are going to area 4 and 6, and also from the posterior ventral thalamic nuclei to area 3, 1 and 2 of cerebral cortex. Also from globus pallidus to subthalamic nuclei, and from thalamus, so they are forming the fasciculus subthalamicus and fasciculus lenticularis. There are fiber of nigrostriate pathway, that is from the substantia nigra to caudate nucleus and putamen. Okay, and thalamostriate means from intralaminar and centromedian nuclei of thalamus with the caudate nucleus and putamen. Then there is retrolentiform part of the internal capsule. So this is extending backward as a continuation of posterior limb along lateral wall of posterior horn of lateral ventricle. So from what fibers are present, here are the fiber of optic radiation. So when you read the visual pathway, so in that the fiber from LGB, that is lateral geniculate body, to primary visual area 17 of occipital lobe, they will go. Okay, they are concerned with perception of vision. And then the fiber of posterior thalamic radiation from the pulvinar part of thalamus to area 18, 19, 39 and 40. So all these are present in the retrolentiform part of the internal capsule. Also there are paritopontine and occipitopontine fibers. Okay. Then the sublentiform part. So we have already seen the visual radiation fibers were going into the going through the retrolentiform part of the internal capsule. So sublentiform part has auditory radiation, that is from medial geniculate body to anterior transverse temporal gyrus, that is area 41 and 42, and they are concerned with perception of hearing. So now you have learned two additional things. The LGB is concerned with visual pathway, and the MGB is concerned with auditory pathway. Okay. So perception of hearing is by auditory radiation, and the fiber will be passing through the sublentiform part of the internal capsule. Then there will be fibers of Mayer's loop of optic radiation. They convey the sensation from lower part of retina. Also there are temporopontine and paritopontine fibers. So these are the fibers which are passing through internal capsule. So if you want to summarize, because through the internal capsule both motor and sensory fibers are going. So if we see anterior limb, the corticopontine fiber will go, and also anterior thalamic radiation will go. From genu, through the genu, corticopontine, corticonuclear, corticospinal fiber of only head and neck will pass, and the superior thalamic radiation will pass. In the posterior limb, maximum fiber will be passing through corticopontine, corticospinal, that is pyramidal fibers for upper limb, trunk and lower limb, and also corticorubral, that is those who are forming the extrapyramidal system. Okay, and then superior thalamic radiation. Then the retrolentiform part, corticopontine, sublentiform part. So here we will say not exactly, so we can say this is frontopontine, and here these are the these are the paritopontine, and these are the temporopontine. Okay, and here you can see the posterior thalamic radiation, optic radiation, the fibers from the through the retrolentiform part are going through the, that is what we have seen, LGB forming the visual pathway, and here they are going through MGB forming the auditory pathway. Now the most important part of internal capsule, that is blood supply of internal capsule. So here you see the blood supply. If you see the internal, the anterior limb, so anterior limb is supplied by medial striate branch of anterior cerebral artery and recurrent branch of anterior cerebral artery and lateral striate branch of middle cerebral artery, which is known as Charcot's artery. So you can see here, so there is the Charcot's artery which is coming from middle cerebral artery, and the recurrent branch, and the here the medial striate branch, they are coming from the anterior cerebral artery, they are supplying the anterior limb. The genu here is supplied by recurrent branch of anterior cerebral artery, then the lateral striate branch of middle cerebral artery, and direct branches from the internal carotid artery. And if you see the posterior limb, that is supplied by striate branch of middle cerebral artery, then anterior choroidal artery which is branched from middle cerebral artery, and the posterolateral branches of posterior cerebral artery. Here we are seeing the circle of Willis. Then sublentiform part is supplied by the anterior choroidal artery and branch from the posterior cerebral artery, and the retrolentiform part is supplied by posterolateral branches from the posterior cerebral artery. Okay, so what is the applied anatomy? So here you can see the internal capsule is one of the most common site of cerebrovascular disorder. If there is thrombosis or rupture of striate branch of middle cerebral artery, so as we know, the striate branches of middle cerebral artery, what does they supply? Okay, so here we can see the striate branches are supplying the posterior limb. They are also supplying here the lateral striated branches, they are coming from middle cerebral artery, so they are supplying genu also. So because of that, there will be contralateral sensory loss and hemiplegia, that will be UMN type of lesion. Then there is Charcot artery, which is also known as artery of cerebral hemorrhage. Thrombosis of recurrent branch of anterior cerebral artery. You see the recurrent branch of anterior cerebral artery is supplying the anterior limb also, okay, and it is supplying the genu also. So because of that, there will be ipsilateral hypoglossal paralysis and contralateral paralysis of upper limb and face. And if there is thrombosis of anterior choroidal artery, there will be contralateral hemianesthesia, hemianopia and hyperacusis. Okay, because if we see anterior choroidal artery is supplying the sublentiform part also, and here it is supplying the posterior limb also. So that is the applied anatomy of the internal capsule, and this is the summary of the white matter of the cerebrum. There is association fiber, I told you, superior longitudinal fasciculus, inferior longitudinal fasciculus, uncinate fasciculus, cingulum, fronto-occipital fasciculus. And the commissural fiber are corpus callosum, anterior commissure, posterior commissure, habenular commissure, commissure of fornix. And the projection fibers are corona radiata, fornix and internal capsule. Out of these, the most important are the corpus callosum and internal capsule. Okay, so thank you.